Welcome back to Deep Dive Med, everyone. You know how we love to unpack complex medical topics.
Absolutely.
Well, today we're taking a deep dive into how the nervous system, meds, medications, and respiratory health are all intertwined.
Should be an interesting one.
It is. And,
Yeah.
we did a deep dive on pH levels a while back.
Right, right.
The nervous system, well, it's kind of like your body's control center. And it responds to internal changes like those pH levels and external things like medications.
Yeah, think of your nervous system like it's a massive communication network, constantly sending signals to keep everything working in sync.
So we're talking about the brain being the big boss, right?
Yeah.
Making all the calls, telling the body what to do, breathing, digestion, the whole 9 yards. But how does that message actually travel down to, let's say, the lungs?
Oh, that's a great question.
It's not like there's like a tiny little phone line running down there.
Yeah. No, definitely not a tiny phone line. So your nervous system actually has two main parts. You've got the central nervous system, that's your brain and your spinal cord, and that acts as the central command.
Gotcha.
And then you have the peripheral nervous system, and this one branches out from the spinal cord, carrying those signals to all parts of your body.
So it's like the messenger system.
Exactly.
Okay, so like if I touch a hot stove, that signal goes from my finger, zips up through those peripheral nerves, up to my brain.
Right.
My brain says, nope, not good, and sends back an urgent message. Get your hand off of there.
Exactly. Pull away.
Yeah. Danger, Will
Right.
Robinson. Danger.
Uh-huh.
But what's really cool, at least for today's deep dive, is the autonomic nervous system.
Yes.
And this part's all about those things we don't have to think about, like our heartbeat, digestion, and, breathing,
Yes.
which is super important for today.
Very important.
Involuntary stuff, huh? Sounds pretty crucial.
Oh, it is. And here's where medications come in, because we can actually use medications to target this system. And we can either enhance or block its effects, particularly when it comes to breathing issues.
Oh, interesting. So we can tweak those automatic processes with meds.
Yes, exactly.
Wow, that's pretty amazing. But wait, you said the autonomic nervous system has two parts, right?
Yes, that's right.
What were they again?
The sympathetic and the parasympathetic.
Okay.
So picture the sympathetic nervous system as your body's like fight or flight response. Okay, so imagine you're strolling through the woods and suddenly, brum, you run into a bear.
Whoa, scary.
Right. Your heart starts racing, your breathing gets faster, and your airways open up so you can take in all that oxygen.
It's getting ready to run.
It's getting you ready for action.
Okay, makes sense. So then what about the parasympathetic side? Does that kick in after I've outrun the bear?
You got it.
Okay.
It's all about rest and digest. It slows things down, lowers your heart rate, helps you digest food, and it'll constrict your airways a little.
Okay.
It's the opposite of fight or flight.
So it's like my body hitting the reset button.
Exactly. After that stressful encounter with the bear, you need to
Right.
calm down.
Right. So meds can either boost that fight or flight response or encourage the rest and digest mode. That's amazing
It is.
that we can actually like control those
Yeah,
systems.
we can influence them.
Yeah, it's incredible. So how do those medications know where to go in the body and what to do? It's not like they have tiny little GPS systems, do they?
That's a great question. And that's where things get even more fascinating. It all comes down to receptors. And these are like tiny docking stations found on the surface of your cells. Medications have specific shapes that fit into these receptors, like almost like a key fitting into a lock.
Okay, so different meds have different keys that fit into different locks on our cells.
Exactly.
Oh, that's amazing. I never really thought of it that way.
It's pretty cool, right?
Yeah.
And for today's deep dive, we'll be focusing on one type of receptor called beta receptors.
Beta receptors.
Okay, so you have beta-1 receptors, and those are mostly in the heart. And then you have beta-2 receptors, which are in the lungs and other organs.
Wait, if medications target specific receptors, like those beta-2 receptors, how do we make sure they only affect the lungs
That's a great question.
and not other parts of the body that have those same receptors? It seems like that could cause some problems.
It could, but the concentration of the medication and the way it's given, like if it's inhaled or taken as a pill, helps control where it goes and what it does. So with inhaled medications, for example, we're delivering a higher concentration directly to the lungs.
Ah, so it's like a targeted delivery system.
Exactly.
Okay, that makes sense. So if a medication is supposed to open up the airways, it would be designed to target those beta-2 receptors in the lungs specifically.
Exactly. That's exactly right.
Got it. This is fascinating. I never knew all this was going on behind the scenes.
It's a lot happening at the microscopic level.
It really is. But, I have to admit, all that talk about agonists, antagonists, it gets a little confusing sometimes.
I hear you. Medical terminology can be a bit like learning a foreign language, can't it?
It really can.
Yeah.
So can you break it down for us? Like, what are agonists and antagonists in simple terms?
Absolutely. Think of agonists as those cheerleaders on the sidelines. They boost a natural response in your body. They're like, go team, go, you got this. And they're often called mimetics because they mimic a natural process.
Okay, so an agonist is like giving the nervous system a high five.
Exactly.
Okay, and then you have antagonists. What are those?
Antagonists are more like the referees, blowing the whistle and saying, hold on there, slow down.
Okay.
They block a natural response.
Gotcha. So it's like telling the nervous system to take a chill pill.
Exactly.
Okay, that makes sense. So do you have an example of those in action?
Sure. A good example is a beta-2 agonist, like albuterol, which is often used for asthma. It stimulates those beta-2 receptors in the lungs, telling those airways to relax and open up so you can breathe easier.
So albuterol is the cheerleader for Team Open Airways.
Exactly. It's cheering them on to relax and let the air flow freely. And knowing these basic terms can really help you decode how different medications work.
I like that. It's like having a secret decoder ring for the world of pharmacology.
Exactly.
Okay, let me see if I got all this straight. We have the nervous system acting like the control center, right? It sends messages through these peripheral nerves. The autonomic nervous system, well, that's in charge of those things we do automatically, like breathing. And then there's the sympathetic, the fight or flight side, and the parasympathetic, the rest and digest mode. And medications can target specific receptors on our cells to either boost or block those natural responses.
That's an excellent summary.
Phew! I'm starting to feel like I'm getting a handle on all this.
It is a lot to take in, but you're doing great. It's remarkable how much is going on beneath the surface.
Right. It's all thanks to this amazing network of nerves and chemical messengers.
Exactly.
I'm already feeling more confident in understanding how medications work.
I'm glad to hear it.
But how about we look at a real-world example to see how all of this comes together in practice?
Sounds good.
Would you walk us through that?
Absolutely. Let's imagine we have a patient with asthma who's taking several different medications. Ipratropium bromide and tiotropium bromide, both anticholinergics,
Okay.
albuterol, a beta-2 agonist,
Mm-hmm.
labetalol, a beta blocker,
Okay.
and then just acetaminophen for pain.
Whoa! Okay, that's quite a list of meds.
Yeah.
So where do we even start with trying to make sense of all that?
Well, first we have to consider what each medication does and how it interacts with the nervous system.
Okay.
So ipratropium bromide and tiotropium bromide, those are both anticholinergics, which means they block the effects of acetylcholine,
Acetylcholine. Okay.
which is a neurotransmitter in the parasympathetic nervous system.
Hold on. I'm a little confused here.
Sure.
So if blocking acetylcholine is good for asthma, doesn't that also mess with other stuff that the parasympathetic nervous system controls?
You're right to think about that. It can have side effects. But in this case, the benefits for asthma, keeping those airways open, are more important. Especially when it's inhaled directly into the lungs, it's a more targeted approach.
Ah, okay, that makes sense. So less chance of those side effects. What about the albuterol and the labetalol? How do those fit in?
Well, here is where we might have a bit of a problem. Remember, albuterol is a beta-2 agonist. It's stimulating those receptors in the lungs to open up the airways.
Right.
But labetalol is a beta blocker, and that means it blocks the effects of beta receptors, including those in the lungs.
Oh, okay, so we have one med trying to open up the airways and the other one trying to close them.
That's exactly right.
That can't be good.
Not ideal, right? This is a perfect example of how medications can have completely opposite effects.
Yeah. So giving a beta blocker to someone who's also taking a beta-2 agonist for asthma would basically cancel out the good effects of the albuterol.
Yeah, it's like having two people trying to steer a car in different directions at the same time.
So what's the best way to handle this? Do we just pick one or the other?
In this case, we'd want to streamline the medications, make it simpler.
Okay.
So since tiotropium bromide is longer acting, we could get rid of the ipratropium bromide.
Okay.
And to make sure the albuterol works, we would definitely want to eliminate the labetalol.
So we're looking for a more streamlined approach, making sure the meds are all working together instead of against each other.
Exactly.
It's like fine-tuning an orchestra, making sure all the instruments are playing in harmony, not creating a bunch of noise.
I love that analogy. It's a great way to think about it. It's all about making sure everything works together smoothly.
I love it. So it
Uh,
really is all about looking at the bigger picture when we're talking about medications, especially for conditions like asthma, where that balance in the nervous system is so delicate.
you've got it. It's not just about understanding the individual medications, but how they all work together within the body's systems.
This has been so insightful. I feel like I've learned a whole new level of understanding about how the nervous system and medications work together.
I'm glad to hear that. It's a complex topic, but it's so important for understanding how our bodies work.
Yeah, it really is like trying to conduct an orchestra, making sure everything's in sync.
It is. You need to know how each instrument works and how they all sound together.
Right. Speaking of things working together, you mentioned acetylcholine earlier. You said those meds, the ipratropium bromide and tiotropium bromide, they're anticholinergics.
Yeah.
So they block acetylcholine. What exactly is acetylcholine, and what does it do in respiratory health?
Acetylcholine is a neurotransmitter, and it's a chemical messenger that helps nerve cells talk to each other. It's actually a key player in both the sympathetic and parasympathetic nervous systems.
So it's kind of like a versatile actor. It can play different roles depending on the situation.
That's a great analogy. So, for example, in the parasympathetic system, acetylcholine helps slow down the heart rate. It also constricts the airways and stimulates digestion. But over in the sympathetic system, it can actually do things like stimulate sweat glands and blood vessels. So it does a lot.
Wow, that's pretty impressive. One tiny molecule doing all that.
It is.
So when we block acetylcholine with a medication like an anticholinergic, we're basically turning down the volume on the parasympathetic nervous system.
Exactly. That's exactly what's happening. And in the case of respiratory problems like asthma, that can actually be a good thing
Okay.
because it can help keep those airways open by counteracting that natural tendency for them to constrict.
It's amazing how much we can do to influence these complex systems with medications. Are there any other key terms or concepts we should know about when it comes to, medications and how they affect the nervous system, especially when we're talking about respiratory health?
Well, we've talked about agonists and antagonists. Those are the main ones, but there are a couple of others that might come up.
Okay.
So you might hear the terms sympathomimetic or parasympathomimetic.
Those sound a little intimidating.
I know they sound a bit complicated, but they're not as bad as they sound.
Okay, good.
Sympathomimetic just means the drug is mimicking the effects of the sympathetic nervous system.
Okay.
So it basically produces effects like increased heart rate, bronchodilation, vasoconstriction.
So it's kind of like a synthetic fight or flight response.
Exactly. It's like flipping that switch. And then you've got parasympathomimetic drugs. And as you can probably guess, those mimic the effects of the parasympathetic nervous system. So things like a slower heart rate, bronchoconstriction, and increased digestive activity.
Okay, so those terms basically tell us which part of the autonomic nervous system the drug is copying.
Right. That's a great way to think about it. And remember that those terms are often used interchangeably with agonist or antagonist.
Oh, okay.
So a sympathomimetic drug could also be called a sympathetic agonist, and a parasympathomimetic drug could be called a parasympathetic agonist.
Got it. That helps to connect the dots. But how do we keep all of these different terms and concepts straight? It's a lot to remember.
Well, one thing that might help is creating a simple chart
Okay.
that summarizes the key players in the autonomic nervous system. List out the neurotransmitters, the receptors, and the effects they have on different organs like the heart, lungs, and digestive system.
So it's like making a cheat sheet for the language of the nervous system.
Exactly.
Okay, I like that. And then I can use that chart as a reference when I'm learning about new medications.
Yes, that's a great way to use it. So you'll want to ask yourself, which neurotransmitter does this medication target? Which receptors does it bind to? And what effect does it have on the sympathetic or parasympathetic nervous system?
That's really helpful. I think that would definitely make it easier to keep everything organized. Are there any other situations where this knowledge about medications and the nervous system is especially important? We've talked about asthma. But what about other respiratory conditions?
You're right, we've focused mainly on asthma. But there are many other respiratory conditions where this is important.
Okay.
COPD, for example, chronic obstructive pulmonary disease. That's a common condition. And it also affects the airways. And the medications used to manage it often target the same receptors and neurotransmitters we've been discussing.
So even though the condition is different, the same basic principles apply.
Exactly. It's like having a master key that unlocks the secrets of different respiratory conditions.
Like that.
The fundamental mechanisms are the same, but the specifics might vary a bit.
This has been such an eye-opening conversation. I feel like I'm starting to decode this whole world of medications and the nervous system.
I'm happy to hear that.
But I do have one more question.
Mhm.
We've talked a lot about medications and their effects on the lungs, but what about potential side effects when we're targeting the nervous system like this?
That's a good question to ask. It's important to remember that any medication can have unintended consequences. And especially medications that affect the nervous system, those can sometimes cause side effects. For example, medications that stimulate the sympathetic nervous system, like those beta-2 agonists we talked about, they can sometimes cause things like an increased heart rate, tremors, or anxiety.
So it's almost like they're turning up the fight or flight response too much.
Yeah, exactly. It's about finding the right balance. And then on the flip side, medications that block the parasympathetic nervous system, like anticholinergics, can sometimes cause things like dry mouth, constipation, or urinary retention.
That makes sense. Since the parasympathetic system is all about rest and digest, blocking those functions would lead to those kinds of problems.
Exactly. You've got it. That's why it's always so important to weigh the potential benefits of any medication against its possible side effects. And it's crucial to talk to your doctor about any concerns you might have.
This has been such a fantastic deep dive. I feel so much more informed now, and I feel like I have the tools to understand the medications I might encounter.
That's great to hear. I'm glad you found it helpful.
But before we wrap things up, could you leave our listeners with a thought-provoking question?
Absolutely. As we've seen today, the nervous system is incredibly complex, and medications can have all sorts of interactions with it. So the question I would leave everyone with is, how might our understanding of the nervous system change in the future? And what new possibilities might that open up for treating respiratory conditions?
That's a great question. It's fascinating to think about all the potential breakthroughs that could be just around the corner as our knowledge of the nervous system continues to grow.
Yeah, it really is amazing to think about all those possibilities out there as we learn more about how the nervous system works.
It is. Just think how even small steps forward in our understanding can have a big impact and lead to new treatments. That could make a real difference in the lives of people living with respiratory conditions.
That's an important point. So let's do a quick recap of what we've learned today.
Okay.
We've been talking about how the nervous system is so crucial for controlling our breathing.
And medications can be used to, well, to either help or hinder those effects.
Exactly. We explored those two parts of the autonomic nervous system, the sympathetic and parasympathetic, the fight or flight and rest and digest responses, remember.
Of course. And then we dove into the world of receptors,
Right.
those tiny little docking stations on our cells
Yeah.
where medications actually do their work. We also talked about agonists, the cheerleaders that boost those natural responses, and antagonists.
Yeah.
Those are the ones that block them.
That's right.
Oh, and we even tackled those big words like sympathomimetic and parasympathomimetic, which I have to admit sounded a bit like something out of a sci-fi movie to me at first.
They do sound a bit futuristic, don't they?
They do, but they're actually pretty simple when you break them down.
Right. Exactly.
They're just describing medications that copy the sympathetic or parasympathetic systems.
Well, precisely.
Yeah.
And then, of course, we had our real-world case study, which really highlighted how important it is to understand these interactions, to make sure we avoid any potential conflicts with the medications.
Right. It's all about making sure those medications are working together, not against each other.
It's like making sure all the ingredients in a recipe work well together to create a delicious dish instead of a disaster.
That's a great analogy.
It is. It's about taking a step back, looking at the big picture, seeing how medications interact, not just individually, but also within the whole complex system of the body.
Yeah, it's a great reminder that our bodies are pretty incredible and super intricate.
They really are.
Well, I feel like we've covered so much ground today, and in a way that was both thorough and easy to digest.
I hope so. That's always the goal.
It's like we took this complicated map, unfolded it, and highlighted all those hidden pathways and connections.
That's a great way to put it. And I hope our listeners feel more empowered now to understand how medications work and to be active participants in their own healthcare.
Absolutely. This has been an amazing deep dive. Thank you so much for sharing your expertise with us.
My pleasure. It's always exciting to talk about the wonders of the human body and how it all works.
And on that note, we'd like to thank all of our listeners for joining us for another Deep Dive Med. Be sure to like and subscribe to the channel so you don't miss our next episode. And for more exclusive content, check out our Patreon. You can find the link in the description below. See you next time.